Welcome to this deep dive. Today, we're tackling a really serious issue, doctor abandonment. It actually affects quite a few people every year.
It does.
And our aim here is to really unpack what it means, how to recognize it, and maybe some steps you can take to protect yourself.
And it's so relevant now, isn't it? With healthcare always changing, providers moving, insurance networks shifting, it's easy to feel lost.
Exactly. Understanding your right to continuous care is just vital. Okay, now before we really jump in, we have to say this conversation. It's for informational purposes. It's absolutely not a substitute for, proper legal or medical advice tailored to you.
Definitely not. And if you have a medical emergency, please call 911 or your local emergency services immediately.
Crucial point. Our goal is just to shed light, give you knowledge.
Empower you a bit, yeah.
So let's get started. What is doctor abandonment, really? Can we define it clearly?
Okay, so at its core, doctor abandonment or patient abandonment, you hear both. It happens when your doctor ends the relationship, the professional relationship, without giving you fair warning.
Fair warning.
Yeah, reasonable notice, or without giving you a decent chance to find someone else to take over your care. And it's especially problematic if you're right in the middle of, essential treatment.
And I know the American Medical Association has something specific on this.
They do. Their code of ethics calls it the unilateral severance, without reasonable notice at a time when the patient still needs continuing medical attention.
Okay, unilateral severance. This sounds pretty stark.
It is. But the tricky part, honestly, is that phrase, reasonable notice.
Ah, right, because what's reasonable, that sounds subjective.
Exactly. It's not one size fits all. It really depends. State laws differ, and courts look at, your specific situation. How sick are you? How urgent is the need for care?
And how easy is it to find another doctor?
Precisely. Are there other qualified doctors available nearby? If you're in a rural area versus a big city, that's different, right? It highlights a bit of a power imbalance sometimes.
Yeah, I can see that. Could you give us some, concrete examples, scenarios where this might actually happen?
Sure. Imagine you have surgery. Afterwards, you develop serious complications, but your surgeon just gone. Unresponsive. Won't return calls. Or your main doctor, your primary care physician, just tells you they won't see you anymore. No referrals, no suggestions for who else to see. Leaves you high and dry for basic needs.
That sounds stressful.
It is. Or maybe a whole clinic just shuts down suddenly. No warning, no plan for getting your records transferred. That can really mess up ongoing treatment.
Right.
And another one, maybe a specialist you see regularly stops treating you because your insurance changed. Okay, that happens. But if they don't help you transition, find someone in your new network. That could be abandonment too. It feels like paperwork over patient care sometimes.
Those examples really help paint the picture. But how is this different from, say, a doctor just deciding a patient isn't a good fit for their practice? Maybe someone keeps missing appointments.
That's a key distinction. Context matters hugely. If a patient, say, repeatedly no-shows for non-urgent checkups and doesn't communicate, a doctor might eventually terminate the relationship after giving notice. That's generally not abandonment.
Okay.
But if a doctor abruptly stops critical care while you're actively being treated for something serious like cancer or heart disease, that's very different. That's potentially abandonment. It's about leaving a patient vulnerable without a safety net.
So it's not just that they end the relationship, but how they do it.
Yeah.
And if they help ensure care continues.
Exactly. That's what courts and medical boards look at. Was the care necessary and ongoing? Was there enough warning? Crucially, did the doctor do anything to facilitate finding new care? Those are the big questions.
Got it. Okay, so if someone feels like this might be happening to them, what are the signs? What should they look out for?
Well, one of the biggest red flags is a sudden refusal to treat you, especially without a good explanation. If you're in the middle of ongoing care for, a chronic condition, and they just say, nope, not seeing you anymore, that's alarming.
Yeah, that would definitely ring alarm bells. What else?
Another huge one is the lack of any transition plan. If your doctor is retiring or moving, fine. But ethically, they should give you referrals, suggest other doctors, help you find someone. If there's just silence, that's a problem. It can create dangerous gaps in care.
Right. And the notice period. How much warning should someone expect?
Generally, the rule of thumb is about 30 days, usually written notice. But again, it can vary by state and situation. The idea is to give you enough time to actually find and connect with a new provider without, panicking or having your treatment interrupted.
So getting a week's notice could be a problem, especially if finding a specialist is tough in your area.
It absolutely could be. And the timing of when they end things is also critical. If they drop you right after major surgery, or while you're adjusting to a new critical medication, or waiting for really important test results, that feels particularly bad. Those are vulnerable times.
Makes sense. What about things like medical records or prescriptions?
Yes, definitely. If you ask for your records to be sent to a new doctor and they're dragging their feet or just refusing without reason, that's a sign. Same if they suddenly stop refilling necessary prescriptions without a clear medical explanation. It suggests they aren't cooperating in your continuity of care.
There was a text you mentioned, legal aspects of healthcare administration. Paulsgar. What did it emphasize about recognizing this?
Posger's work points out that it's not just that the relationship ended, it's about when it ended and whether they made reasonable arrangements for your care to continue. It's the combination, the timing, and the lack of a smooth handoff.
Okay. And what about just communication? If they suddenly stop responding?
That can be a subtle sign, yes. If your doctor used to be pretty good about returning calls or answering questions and suddenly they're unreachable, ignoring messages about serious symptoms, especially if it's a real change in pattern, it could signal a problem with their commitment to your ongoing care. Very worrying if you need guidance.
So doctors clearly have these duties. Where do these obligations actually come from? Is it just ethics or is it law?
It's actually a mix of things. There are sort of four main sources. First, you have medical ethics, like the AMA code we mentioned.
Okay.
Second, state medical board regulations, the bodies that license doctors. Third, often the policies of the hospital or the medical group they work for.
Internal rules, right?
Exactly. And fourth, the basic principles of malpractice law, which establish a legal duty of care.
Let's break those down a bit. The AMA Ethics Code, Opinion 1.1.5. What does it specifically say about withdrawing care?
It's pretty clear. It says doctors should only withdraw after giving sufficient notice, enough time for the patient to find someone else. And importantly, they should help facilitate the transfer of medical records, make it smooth.
And the state medical boards? What's their usual stance?
Most state boards explicitly prohibit patient abandonment once the doctor-patient relationship is established. They generally require written notification before termination with reasonable advance notice. Some states even specify what reasonable means in different contexts.
So hospitals might have even stricter rules on top of that.
Often, yes. Larger hospitals or practices usually have detailed protocols for patient transfers or discharges. Things like documented handoffs between doctors, especially for complex cases or hospitalized patients, to ensure nothing falls through the cracks.
And how does malpractice law fit in? What's the legal angle?
Legally speaking, a doctor has a duty of care that continues until that relationship is properly ended and care has been appropriately transferred. If they terminate improperly, not enough notice, no help finding alternatives, and the patient is harmed as a result. That could be grounds for a malpractice lawsuit. The legal responsibility sticks with them until the handoff is complete, basically.
Are there ever situations where a doctor can end the relationship quickly, like immediately?
Yes, there are some limited, quite specific exceptions. Things like if a patient becomes violent or threatening towards the doctor or staff.
Okay, safety first.
Right. Or if a patient consistently refuses essential treatment, making care impossible. Or maybe if the patient is involved in fraud, like trying to get drugs deceptively.
But even then, they can't just wash their hands of the patient completely.
No, absolutely not. Even in those extreme cases, the doctor needs to meticulously document why they're terminating the relationship. And crucially, their duty to provide necessary emergency care usually continues until safe transfer arrangements are made. They can't just leave someone stranded in an emergency.
This is all really vital information. So let's say someone thinks this is happening to me. What's the very first thing they should do?
Documentation. Absolutely, unequivocally, document everything. Start a log, a timeline. Dates of calls, appointments, emails. What symptoms did you report? What response did you get or didn't get?
Keep everything.
Everything. Save emails, voicemails, any letters, even text messages with the office. Keep a clear record.
And what about tracking the health impact?
Yes, that's critical too. Note down how this lack of care is affecting you. Are symptoms getting worse? Did you need extra treatments because of the delay? Were there complications that maybe could have been prevented? This record is your foundation if you need to take action.
Okay, documentation is step one. Then what? What's the first formal move?
Usually, the first formal step is filing a complaint with your state's medical board. They're the ones who investigate professional misconduct and can take disciplinary action against the doctor's license.
How do people find their state medical board?
The Federation of State Medical Boards, FSMB, has a website, fsmb.org. It's a great resource. You can find contact info and complaint procedures for every state board there.
Good tip. Are there other places to report?
Yes. Consider contacting your state's Department of Health. They oversee hospitals and clinics, so if it's a systemic issue at a facility, they might get involved.
What if the doctor works for a big hospital or medical group?
Definitely reach out to the hospital or group administration. They often have patient advocates or patient relations departments specifically designed to help resolve these kinds of issues internally. Sometimes they can mediate or find a solution.
And your insurance company? Should they know?
It's often a good idea. Insurers have contracts with doctors in their network, and those contracts usually include standards of care and continuity. Reporting potential abandonment might trigger an investigation from their end, too.
And when does hiring a lawyer come into play?
Consulting a medical malpractice attorney makes sense if the abandonment has caused real measurable harm. Worsened condition, extra medical bills, preventable complications, that sort of thing. Most offer free initial consultations, so you can discuss your situation and see if you have a case.
You mentioned a case earlier, Payton v. Weaver. Why was that one important?
Yes. Payton v. Weaver from California back in '82. It's significant because it really tried to balance things. The doctor's right to choose patients versus their duty to provide continuous care.
What happened in that case?
It involved a dialysis patient who had some challenging behaviors. The doctor decided to stop treatment. The court basically said, look, doctors can't just abandon patients, but they aren't necessarily stuck with a patient forever if they make proper arrangements for alternative care.
So the key takeaway is, termination is possible, but only if done correctly, with a focus on ensuring the patient can still get care elsewhere.
Exactly. It reinforces that the process matters. The termination procedure, the effort to facilitate continuity of care, those are critical legally and ethically.
It's really helpful to hear how these ideas play out in real life. You mentioned a couple of stories, one from Florida, one from a rural area.
Right. The Florida case involved a chemotherapy patient. She missed one appointment because she was actually hospitalized for complications from the chemo itself.
Oh.
Yeah. But her oncologist dropped her for non-compliance, even though she explained the hospitalization, and crucially offered no help finding a new oncologist.
What happened?
She documented everything, filed complaints with the state board, the hospital, a patient advocate got involved, and eventually helped her get a new oncologist within that same hospital system. It just shows how vulnerable patients can be during critical treatment.
Definitely highlights the need for advocacy and the rural case.
That one shows the impact of limited access. A primary care doctor in a rural area where there weren't many other doctors announced retirement with only 2 weeks' notice.
2 weeks. That's barely enough time.
Exactly, especially in an underserved area. Patients were scrambling, so they organized. They went to the state medical board as a group, explained the situation, and because they spoke up together, the doctor agreed to stay on for an extra month, manage prescriptions, give them more time to find new care.
That's powerful. Collective action made a difference.
It really did. It shows that informed patients advocating for themselves individually or together can create change.
So we've talked a lot about what to do if it happens, but what about prevention? What can listeners do before anything goes wrong?
Great question. Being proactive is key. When you start with a new doctor, have a conversation up front about continuity of care.
Like what kinds of questions?
Ask things like, what's your backup plan if you're unavailable in an emergency? Or if you were to leave the practice, how much notice do you usually give? And what's your process for transferring records? Get a feel for their policies.
Establishing expectations early? Good idea. What else?
Keep your own health records organized. Copies of test results, treatment plans, medication lists. Having your own file makes transitions smoother if they happen unexpectedly.
Be your own record keeper.
Yes, and create documentation trails for important interactions. Follow up verbal talks with a quick email summary. Ask for things in writing. Keep a log of appointments, requests, cancellations.
What about having more than one doctor? Is that feasible?
If possible, yeah. Having maybe a backup primary care option or knowing other specialists in your field can be helpful if one relationship ends suddenly. Also, really understand your insurance. Know who's in network for emergencies, which providers are covered. That knowledge is power during a quick transition.
And any resources people should know about before they need them.
Definitely. Find out if your local hospital has patient advocates. Know their number. Look up patient advocacy nonprofits, national or local. Just knowing these resources exist and how to reach them can be incredibly reassuring and helpful if a problem does come up.
That's fantastic practical advice. It feels good to know there are steps we can take. So, just to wrap up, doctor abandonment is serious, it happens, but we should also remember.
That most doctors are ethical, dedicated professionals committed to continuity of care. That's important to state.
Absolutely.
Right.
But if you do face a situation that feels like abandonment,
Remember, document thoroughly, report it to the right places, and advocate for yourself assertively. An informed patient is a powerful patient.
well said. We really hope this deep dive has armed you with some valuable insights and practical tools for navigating potential care disruptions and understanding how transitions should work.
It's complex, but knowledge helps.
Indeed. And that brings us to the end of this deep dive.
Thanks for joining us.
Join us next time, where we'll be digging into another really vital area: your rights when it comes to accessing and owning your own medical records.
Ooh, that's a big one, too. Understanding that can really change how you manage your healthcare.
Definitely. So until then, stay informed, stay empowered, and stay awakened.